What about breast reductions in boys? This comment comes from a video about breast reductions in young women, young adolescents. So what happens if a young boy has developed tissue in their chest that's too much? So development of too much breast tissue in boys is called gynecomastia. And we see this in various populations. You can see it in babies when they're still having stimulation from their mom's hormones. You see it frequently in adolescents, like half of adolescent boys will have some degree of gynecomastia. And then you can also see it in older men when they lose hormones. So for adolescents, which is I think the population they're asking for, in general, we rarely intervene because most of these patients improve with nothing done. So we don't want to hop in and do a surgery when it was a problem that would have solved itself. The other thing to consider is that certain medications, and marijuana in particular, have been associated with gynecomastia. So the marijuana studies aren't fantastic, but there is an association we've seen. So it's important to see if you can change medications around for these patients if there is a commonly offending agent they're on, and then also if the patient is using marijuana, ask them to stop. Now, it's also important to mention that some patients that I see in this age group will come with pseudogynecomastia. So they don't actually have breast tissue development. They have a lot of fatty tissue, and that's usually from obesity. So for these patients, we usually refer them back to their pediatrician to discuss options for weight loss and whether or not that's appropriate. We, of course, aren't typically having adolescents lose weight, but if they are obese and they have gynecomastia and are distressed by it, it may be worth a conversation with the pediatrician. So again, just to review, it's very common in adolescent boys to have gynecomastia. It almost always resolves on its own with time. There are some medications and marijuana that can potentially cause it as well. We always want to do non-surgical things first, if at all possible, and then we do intervene occasionally when we need to.